interested as to why, and then that was when we started finding out there are other groups, so we started reaching out to folks and saying, hey, you know, maybe we should, yeah, it was like, hey, stop rearranging pharmacy, but maybe we should talk about how we want to have this arranged all together. So that was the story that I had there. And so the question of whether you have to collaborate, and this was actually a shot from a meeting that we had back in the fall. I think many of you who got the invite, the original plan was to have this symposium in the fall, but I guess that date sort of fell through for quite a few people. So we ended up, the ones of us who couldn't come had like a sort of small pre-symposium meeting in New Haven, Connecticut. And that's Bob, you know, laying down the law with Cheng and Chris there. But essentially, collaboration has a lot of benefits. And, you know, just in general, we've talked about the fundraising piece, but it allows us, as I mentioned, to think longer term, to be something more than the sum of our individual parts. Allows us to come up with shared goals and evaluation, allows us to develop some sort of standardization about what we're trying to do, managing our projects down there collectively. As I mentioned, it allows us to start thinking more broadly and more upstream instead of just focusing on handing out things or, you know, providing downstream primary care. The other thing I think collaboration will do for us is hopefully relieve some of the local capacity. And I think one thing that has been missing in this conversation that I think is really important is we need to have more local input and local leadership in a lot of what is being done down there. But the trouble is that all of us who've been down there, you see how Moises and the entire team at Good Sam has just run ragged trying to keep these teams afloat with all the logistics and everything. If we're able to have some of just the information sharing and being like, hey, instead of sending Moises 10 million emails, ask our wider group on the community what we think about something. Then we can actually relieve Moises of this administrative burden, and he can maybe help to think a bit more strategically, let us know what the hospital is focusing on, bring him in, rope him into more discussions. So I think relieving local capacity, at least relieving some of the administrative burden, is also another benefit of it. And the last one, and the reason for the picture, is that the old teams teach the new teams. I think it's the idea that, you know, just having listened to folks like, you know, meeting up with John, meeting up with Bob, like just understanding where they come from and what they've done, it's been a real benefit, at least for our team. And we've started to see and do things differently and axe ideas that we're just kind of like, well, this idea seemed good at the time, but it sounds like it's been tried already, so we won't try that one again, kind of thing. So the question about, I was asked to talk about the goals of collaboration. I thought a good thing to start with would be, what have we done up until now, right? And so we've had two different versions of a website. Many of you who came to the symposium last year will remember that we actually had a guy out of Texas named Shu who helped put together a very preliminary website, which since has actually been superseded by another cool website that's actually been put together by our friends out at UMass. Actually, and unfortunately, Shu, as much as he wanted to remain involved, had taken ill, so that was part of the reason why that project kind of got stalled. But we've got a website that's coming up now, but in terms of this Salesforce thing, that sounds like another possible platform that we could use to at least just have people collaborate efforts, talk, share information, come up with a shared database of protocols, or, you know, have like an online current real-time project manager, so that if you're going down there, you'll be like, oh, this is what I need to do to help support this specific initiative. We have an email list, which our very capable friends at UMass have been putting together and maintaining. At one point, we had monthly teleconferences, which have been done up until now, and those kind of fizzled out somewhere in the summer. I think when it turned out it was like me, Chris, Elizabeth, and Brian, we were just kind of like, okay, well, it's always good to chat with you guys. I love Massachusetts, but I think we need to figure out another. So we're thinking monthly teleconferences, ways to sort of exchange information regularly, maybe quarterly instead of monthly, but still a good way for our groups to have something like this, but not necessarily have to travel all the way here. I mentioned we've had 3 inter-institution meetings, so we've had 2 right here. This is one of the 2, and we had the one in New Haven that was earlier. And we've actually started, oh, those are photos, yes. I just learned how to use animations on PowerPoint, so I still haven't really figured out what I've animated and what I haven't. So all that to say, so we've had 3 meetings, and we've also had some joint research projects as well. So I know we've actually, we talked about data. What we've actually been doing is we've been, together with the UMass team, we've been trying to mine some of the data that they've brought down. I know some other groups have been reaching out to each other to sort of look at different research projects and actually come up with some numbers and some baseline things that we can work off of. So that's what's been done till now. The question is where to from here, right? And as I mentioned, I think one of the biggest things, I've kept seeing this, is that we really need to have, I really think we need to have more local input into this. And we definitely need to encourage local input by both relieving an administrative burden and actually having them encouraging them to share their views and their ideas. I think, it's a good thing for us to go down there and address needs that we perceive, but I think it's also important for us to figure out what the community's needs are and how we collectively as a group can actually try best to help them with that. The Good Sam Mission Council blessing piece is what we were talking about just now. The idea that we can still go down as our individual organizations, institutions, maintain our autonomy that way, but there does need to be some sort of face of the organization, someone that people can identify with readily. Whether it's Good Sam Mission Council or some other forum, I think that's something that we need to decide on if we are going to come up with a bigger collaborative model. The other piece is other players and teams we don't know about. So where to from here? I think it's really great to see all of you guys out here. I definitely counted more teams on the trip schedule this year that are probably not here, that we should probably try to find out who they are, where they are, how we can bring them into the fold, why they're not necessarily engaged with the wider community right now. And then the last thing is that the idea has been pitched around of coming up with a hospital department in La Romana that's locally led, that is specifically focused on the Bateys. Instead of having some people who are just kind of doing it off the side of their desks or whatever, having a group in the hospital that helps to essentially bring the teams down, run the teams, and also inform the teams about what local needs are, what needs to get done, essentially centralizing it in a specific department that is earmarked to focus on these Batey sort of outreach things. So the model that we're proposing, or one proposed model, and everything here is essentially up for discussion. It's going to be really curious to see where today goes, and I think this is part of the excitement that I have for what today is going to be, is if we had like a Department of Batey Health and Wellbeing, and I think this proposal has gone around to a few people. I'm not sure how far it's gotten, but the idea that you have these dedicated healthcare providers and administrators in the hospital who would essentially liaise with the visiting team, monitor the Batey programs, especially when teams aren't around or available, and essentially link in all the different players and provide logistic support for joint initiatives. So in that sense, it still stays with the hospital. It actually encourages more local input and involvement, and it also achieves our goal of having a centralized place where we can all go to for information. Of course, it would need to be supported by our own efforts and by the efforts of including the IT and all the other pieces there, but somehow centralizing things and at least coming up with a department would reinforce both our commitment and Good Samaritan's commitment to the Batey communities, and would actually allow us to ensure that local input is sought and kind of front and center in what goes on. So, some closing thoughts that I have here. Things to talk about. I mean, clearly we've gotten to a critical mass of investment in the Bateys, just in terms of who we are going down there, in terms of volunteer hours, in terms of finances. And my question is, we're using them well with what we can do individually right now, but are we using it the best way when we're doing it just individually and providing downstream primary care? Food for thought, right? The other question, the question I've asked throughout my talk is, can we simultaneously relieve the burden on Good Sam's leadership while also improving the impact on the communities in La Romana by working together, by sharing information? Can we actually match our intentions, which is to see, we really want to see large-scale, massive change in the Bateys. Can we match it with large-scale, massive outcomes in terms of our intention and outcomes? And in order to get there, how do we do it? And essentially, how do we make this happen? You're all clearly interested in it. You've all come here today. I think it's a question of how do we actually make this work at this point. So I'm excited about the potential that we have here today. I'm inspired. Like I said, this is a fourfold increase or fivefold increase in terms of people from last year. And so with that, I thank you and happy to take any questions and discuss.